So breast reduction surgery is surgery to make the breasts smaller, and usually at the same time you will lift the breasts to put them in where they're supposed to be, in the right place. Um, a lot of people are candidates for breast reduction. What I tend to find is that you could be any age. It doesn't matter what age you are, and that a lot of females suffer from having big breasts. It causes them a lot of problems in terms of the weight of them, the back pain, the inability to exercise, you know, problems with hygiene and keeping them, the skin care. Um, also problems with self-image, finding the right clothes, being, more or less harassed by people about their breast sizes and all that. So, if you are fit and well, it doesn't matter what age you are. I think it is an operation that for most people that have it, it changes their lives in a positive way because it gets rid of all of a lot of these issues. So I think, anybody who has large breasts is suitable for it as long as they're medically fit, obviously, and they are not extremely overweight. But otherwise, you shouldn't people shouldn't feel that they're too young or too old for it because it gets assessed on an individual basis. As we said, it's one of these quite emotive subjects for people because eh, most of the people, or a lot of the ladies that I end up doing the breast reduction for, have pondered it for a long time, sometimes decades. And uh, again, it's because of the psychological aspects, the physical aspects of it, and when they do have it, you see them and they're instantly different. They look like they've lost weight because they're wearing less baggy clothes. They're wearing something that suits them. They feel less body conscious, if you will. And obviously the physical aspects in terms of the neck pain and the shoulder pain and looking after smaller breasts is quite a big positive. Everybody that I've had it done who's considered it for a long time, the first sentence you hear them say is, "I wish I've done it sooner." Well, breast reductions, there's mainly two types of incisions that we do. One which is what we call the lollipop, which is less common, and the other one is the anchor type scar, so a scar around the nipple and going down and then across the breast on the bra line. Um, Most reductions are done using the anchor scar type. Now, the nipple is usually kept on a blood supply, and that varies between patient to patient, and it could be on something what we call superior medial pedicle. It could be on a superior with pedicle or inferior, but these are technical issues. I think the decision of how to keep the nipple and how to move it is something that is discussed with the person when the surgery is being planned for. But good surgery, especially good reductions, require extensive scarring because what you need to do is reshape the breast. And breast reshaping, if you don't reshape the breast enough, then the result will not last long enough, and the breast will fall, will droop down again. So, don't, my advice to people is don't be afraid of the scars. Most people, it will fade away quite extensively, but good surgery means good scarring. Obviously, when you have it, when a patient has this, then they will be given bras to wear, and those bras, the post-surgical bras, will be worn for about 6 to 8 weeks after surgery, and they're quite important in order to shape the breast and help healing. Um, the actual recovery in itself, for example, with my patients, I don't use drains. The operation itself is a day case, so you come on the day and you go home on the day. And I don't even prescribe painkillers. I say to people, just get some paracetamol, ibuprofen. You'll use them for a few days, and the soreness will go after that. So most people are absolutely fine. When I see them a week after to change their dressings, they're usually fine and mobile and doing things. So, but I usually suggest that you take 2 weeks off work. Well, all operations have complications, but these things obviously are mitigated by good patient selection, avoiding if you have risk factors like smoking or diabetes or being overweight, then those need to be managed before having the operation. Uh, and there are like there are general risks with operations such as like infection and bleeding and poor wound healing. I think the most important things with regards to the breast reduction in terms of expected results is that the final result will probably take about 6 months to be set, and also significant problems can happen, such as nipple loss, or if you're considering breastfeeding, you might lose the ability to breastfeed, or you lose a sensation in your nipple, and sometimes part of the fat of the breast can die. But these are very rare.